Hello and welcome to the first episode in a brand new podcast, Taking Care of Cancer, from the Clatterbridge Cancer Centre NHS Foundation Trust. We're going to be hearing from doctors, scientists, patients, and lots of other people with stories to tell about taking care of cancer. I'm Caroline Kenyon, and to start us off, I'm joined by three guests, all with very different stories to tell about taking care of cancer. Liz Bishop, Moira Griffiths-Parr and Charlotte Smith. So should we start with some introductions? Liz, tell us a little bit about yourself.
Thank you, Caroline. So I'm Liz Bishop and I'm Chief Executive at the Clatterbridge Cancer Centre. I'm a cancer nurse by background. I've worked in the NHS for 40 years. 30 years of those have been in cancer. So I've had many years of looking after patients directly with cancer, treating cancer. And now I lead a whole team at the Clatterbridge Cancer Centre, really looking after patients in our region with cancer, trying to provide the very best of care and treatment to support patients through that journey. Thank you, Caroline.
Thanks, Liz. And Charlotte?
Hi, so thanks, Caroline. So I'm Charlotte Smith. I'm a consultant in public health and I work in Sefton Council, and I work alongside lots of colleagues from the NHS and also from the other local authorities in Cheshire and Merseyside, and we have a responsibility to try and improve the health of the populations we serve. And I've also got an interest in cancer, and I do some work with the Cancer Alliance around prevention and early diagnosis, and I'm really happy to be here today. Thank you, Caroline.
And thank you. And Moira?
My name is Moira Griffiths-Parr, and I'm a patient at CCC Liverpool, having been treated at the old Royal Hospital, and I have had chronic lymphocytic leukemia for about 11 and a half years. And I am treated by the most incredible team at CCC, and yeah, I am part of that team because when my prof first looked after me, he said, "You are part of this team." So I feel very blessed in being looked after the way I have been looked after over 11 and a half years. I've also done 3 clinical trials in that time as well.
And looking forward to hearing more about your story, Moira, so thanks for being here.
Thank you.
But first of all, we've got to ask Liz, why are we doing a podcast, Liz? What's the thinking behind Clatterbridge having its own podcast?
So I think what we're very keen to do is to raise the awareness of cancer, looking out for symptoms, knowing where you can get help, encouraging people to take care of their own health so we can all do things to try and prevent cancer in the first place, as well as making sure that you go to your screening when you're called up for screening. That's so important, because the earlier we get cancer, the more likely we are to be successful at treating it. And I think Moira's testament to patients living with cancer. There's more and more people living with cancer, and I don't necessarily think the public or people understand that. And I think the other thing is to highlight the great progress that's been made in detecting cancer. We might hear a bit more about that during these podcasts, the progress that's made. And even in the 30 years I've worked in cancer, it's changed so much. There are so many more treatments, and patients are doing really well in terms of outcomes. But we want to do more. Our job is never done. And I think raising the awareness in the first instance is really important. And we want the public to know what to do, what to look out for, and where to get help, as well as understand the great progress that's been made in innovation and research. And Moira's already described she's been on 3 trials already. So, she's a fantastic example of someone who's living with her cancer and looking fantastic, I might add, Moira.
Is it an idiot question to ask you, Liz? What is cancer? How do you describe what is cancer?
So I think, again, people think of cancer as one disease, but there's over 200 different types, many different subtypes, and we've moved into what we call more personalised diagnosis and treatment. So again, even in my journey, in my career, I've seen, something like breast cancer, and then an understanding that there's 25 plus different subtypes, all with different, plans that need to go along with those. So it's very complicated. It's quite complicated being a patient, and it was great to hear Moira talk about how she feels, she feels part of that team. She's got close relationships with the staff at Clatterbridge, and she feels safe and confident that she's being managed well. So I think it's not one disease. Let's understand that. It's not even just prostate, lung, bowel, gynae. There's lots of different diseases. And at the Clatterbridge Cancer Centre, we have all those specialists that know and understand those diseases in great depth, like the professor that's looking after Moira. The whole team wrapped around patients that mean ultimately their outcomes will be better. But what we want to do, and I think Charlotte will talk more to that, is really raise the awareness of when you have a new symptom, the sooner we get you, the quicker we can treat you and diagnose and treat you, the impact on your outcomes and survival is vastly different. Do not sit on symptoms. Accident and emergency is not the place to get diagnosed. So you need to be body aware, look out for those symptoms, pick up your screening and get help as quickly as possible.
I think that'll come across in your story, Moira. So let's hear what happened to you. What were the symptoms that prompted you to seek help, and what was your life like at the time?
Yeah, Liz is quite right. It's a good place to start. Having a blood cancer, how is a blood cancer picked up? Well, sometimes for a lot of people it's only picked up by a blood test. But there are other underlying issues there which one might ignore on a day-to-day basis. But I used to get exceptionally tired. I could look at the clock at 2:00 in the afternoon. I would get massively tired. And then, as Liz said, the lumps and bumps started appearing. So as soon as that lump started appearing, I think that was the time when I went to see my GP. And I was very, very lucky in having a wonderful GP at the time who only treated me with antibiotics for 1 week and then sent me to see a specialist. And that was originally at Arrow Park on the Wirral. So, in patients' reactions to their body, I think that's massively, massively important. We can't ignore anything that's going on in our body. As a matter of fact, we're being unkind to ourselves if we don't. In doing that, that was the kickstart really for going on. And originally being, diagnosed after having a biopsy, and then being told, I had a cancer. And going on to getting, treatment for that. I was first diagnosed with SLL, small lymphocytic lymphoma, and my daughters weren't very happy with that diagnosis and wanted me to get a second opinion. I'd like to say at this point, don't be frightened as a patient to get a second opinion. Your physicians are very, very accommodating in relation to if you ask that question. And I've got to say my physician at the Wirral was very, very accommodating and very helpful. And that's how I came over to the Royal as it was then, because we didn't have our beautiful CCC building 11 and a half years ago. So that's where I started. And as soon as my prof saw me and he saw this lump in my neck, he said, I've got a clinical trial. Are you interested? And my belief in clinical trials is so strong. I really, really do believe that it's a question that all patients should have in the back of their head when they're diagnosed. Is there a clinical trial for me in relation to this condition? How can you treat me? Is there a clinical trial? And I also believe, our clinicians and our professionals, our wonderful nurses, should also have that in their mind when they're talking to their patients and reminding them that have you thought about a clinical trial? So basically that's where I started from. So my initial treatment was on a clinical trial.
Now you've had 3 clinical trials.
I have.
For 11 and a half years.
Yes.
Have you seen a difference in the kind of trials
Yes.
and treatments that are available over that time?
Yeah, absolutely. I always remember a matron who was on my ward, at Ward 7, over in the Old Royal, the wonderful Eddie. and she said something which has always been in my head. There is always something new around every corner. And as Liz was saying before, there is, we can live with our cancers if, obviously, we are treated quickly and as appropriately and as effectively as we can be. And I really do believe that, that there has been massive steps to in relation to medication certainly for blood cancer over the 11 and a half years that I've been involved with. And that's also speaking to other, fellow cancer buddies. It's remarkable and it's still happening even today. And, I really do believe from a clinical trials patient that I don't think I might not be here without clinical trials. And, I've been exceptionally fortunate. There are the ups and downs with clinical trials, and I could, chat on for quite a long time about them. But clinical trials are something which I don't think patients should be worried or scared about, because you are exceptionally well looked after and monitored under the terms and conditions of the trial.
And we're going to hear more about research and trials and innovation in a future episode. We know there are some fantastic breakthroughs in science, but in the meantime, are more people developing cancer? And why is that, Charlotte?
Well, that's an interesting question. So I think that there have been an increase in diagnoses of cancer, and I think we can explain that because there's an ageing population. And as we get older, if we think about the cells in our body, every time they divide, which happens all the time, there's a chance that something can go wrong and that they could become cancer cells. And obviously, as we get older, we accumulate all those risks, and lots of cell division has happened. So as we get older, that it's natural that we will experience more cancers in our lifetime. Most of us, if we're lucky enough to live that long, will develop cancer. And that's something I think that we need to understand as a population. We need to understand that we need to recognise the signs and symptoms early, and there's lots of things that we can do. We need to get treatment at an early stage, and that's why it's really important to raise awareness.
I have heard that people in deprived areas suffer more from cancer. Why is that?
I think that there's a whole bunch of reasons. And what we need to think about are some of the other risk factors. So we know that around 40% of cancers are related to our lifestyle. So that's smoking or not smoking, alcohol, obesity, healthy diet, physical activity, and avoiding UV exposure. They're the sort of big things that can influence our risk of cancer. And what we know is that people who live in more deprived areas are more likely to have accumulated lots of those exposures, which makes them more likely to get cancer. And what's really important is it's not only that, it's also that they're more likely to present at a later stage. And I think that's the real tragedy, because it's really important to go at an early stage if you notice something's wrong and get help. It's probably also worth mentioning the cancer screening programme. So there are also programmes in place to find cancer at an early stage. And I think we have breast cancer screening, we have bowel cancer screening, and we have cervical cancer screening across England. And it's really important to take up those appointments. And I think that we have to understand there are probably reasons why people who maybe live in families with less resources are not able to take up those opportunities. So sometimes it can be around things like not being registered with the GP, so you don't receive the invitation. But it can also be about access to, travel expenses, childcare. Those people maybe are more likely to be carers. So I think it's about understanding the context within which people live, and how they have to prioritise within their lives, around the challenges they face every day.
And on that topic about making sure people from all backgrounds do access regular screening and go and seek help if they spot a symptom, we are going to hear now from the Health, Inequalities and Public Engagement Lead for the Cheshire and Merseyside Cancer Alliance, Jo Trask. Jo Trask, what are the reasons why not everybody turns up for their screening appointments?
So I think it's really important to get out and speak to people. I think this is one of the most important things that we do within our organisation. We know patient engagement's really important, but what does that actually mean? It means actually getting out on the streets, perhaps at car boots or markets, and talking to people about how they experience cancer, how they experience screening, what they think about campaigns, what influences them to attend or not. We were really surprised this year. We went out specifically looking at screening, and we were surprised about 80% of people are fully up to date with their screening policies of the people we spoke to. But of the other 20%, people who don't go, 75% of those people just don't want to know the answer. So the barriers aren't things like, well, I wasn't informed or I haven't been asked. They were very much around, well, actually, I don't want to know that outcome. And I think, you know, talking to people about that, it's kind of worrying, because what we think perhaps in the NHS doesn't always translate. What we offer people as information isn't necessarily what people are picking up. So a good example of that would be when the screening campaigns say, and it's a good example, Jo went for her screening. Jo got picked up as having cancer really early. Jo was treated well, and now Jo's well. So we think that's a great campaign, it's really positive. But actually people said, well, I don't want you to pick up cancer. So it's hard. You think, well, that's what we're trying to explain, but what people want is, Jo went for her screening, Jo didn't have cancer, the end. So we're very much translating that back into services, telling people want good news stories. They want to know that when you're screening, actually 99.7% of people don't have cancer.
How are you helping healthcare staff to overcome these barriers?
So, like I said, we're in a really privileged position to be getting out and speaking to people, and in the NHS, people are very busy devising screening programmes and looking at kind of behavioural science, and what we're able to do is package together that anecdotal data, those stories that people tell us in the street, and send them in regionally, nationally, into screening teams, and say to them, this is how it feels outside, this is how people feel about it. So, and have discussions with them. I regularly speak with the national screening team. A lot of the campaigns are national, but also we're looking what we're doing locally. So in the region, there are some gaps in the people we see. So we're looking at how do we focus our regional screening as well? How do we work with groups to make the most of that information and target people who perhaps wouldn't come forward with an appropriate method? An example would be urban myths. So in one of the areas I work in, lots and lots and lots of young women, a really high proportion, haven't been for cervical screening, and they would tell you quite confidently it's because you are screened when you give birth. So lots of them had children recently. So I'm talking high percentages of the population are fully understanding of this myth. So a great way to work with that is to get a local healthcare worker or somebody known to that community to go in and say, really simply, this isn't true. You know, we need to get you to go for some screening now, because that doesn't happen. So gently, so as not to mock people. We would never ever want people, you know, urban myths become very solid very quickly. So that would be an example where we found that information out, and then we can inform local NHS services on how to go in and deliver.
Liz, you must hear lots of stories about people ignoring symptoms and then not going to a doctor till quite a late stage, which must be very frustrating for you as chief exec of this fantastic specialist cancer trust. How does it make you feel when you hear those stories?
So I think there's two parts to the response to that. The first is that, we heard from Moira that one of her symptoms was fatigue, tiredness. Well, there's lots of reasons why people are tired, and you may not associate that with a diagnosis of cancer. So I go back to my earlier point about really being body aware and taking note of changes in your body. And, even if the symptoms seem quite vague, but there's common things like Moira also mentioned lumps, feeling tired, moles that look different, weight loss, change in bowel habit, persistent cough. So that could be a reason why there's a delay, that people don't associate that symptom with getting help or a diagnosis if they're quite vague. The second part is, I remember when I was a young nurse and reading and studying cancer, I read this study about patients with breast cancer, and I remember feeling quite shocked when I read it. And it was a study that said from the moment a woman feels a lump in her breast, the average time for seeking help is 12 weeks. Now, it's related to anxiety and fear, and perhaps some of the reasons that Charlotte said, about knowing where to get help and having that accessible help. But I can't stress how important it is that some cancers, not all, remember some cancers we just watch and wait and we don't treat straight away. But some cancers are time critical, and you won't know that till you undergo some tests and get that precise diagnosis. So do not delay, get help, register with a GP if you're not registered, and go and find out what's wrong with you. And when patients get referred, so say you go to your GP with a set of symptoms and the GP is very worried about you, and you can be referred on an urgent pathway, we have to get those patients diagnosed within 28 days. They might need 6 different tests that need to come together to give a conclusive diagnosis. But it's really important we crack on with that diagnosis and get that diagnosis so we can get the right treatment. And if we do delay, then because of that, some cancers divide really quickly and they can grow really quickly. And we stage cancer, so it can be early stage, we call it 1 or 2, late stage 3 or 4, and it can mean a difference to your outcome, and ultimately your survival. So again, I don't want to frighten people, but it is just that get help quickly because it is time critical.
And Moira, I know that your cancer is one that's a long-term condition in effect, isn't it? It's a manageable cancer. But how do you feel hearing that story about 12 weeks after finding a lump to go and seek help?
Yeah, it's unfortunate in many, many ways. Obviously, because that has a major effect not on just the individual, but it has an effect on their family. And it's quite shocking to for me to hear. It takes that long. But you've got to, as Liz says, you've got to listen to your body. Don't be scared about listening to your body. It might not be anything, untoward. Sort of for breast cancer, I know that women, we can have cysts. Doesn't necessarily mean to say that lump is a cancerous lump. So, I think we have to be aware of our bodies. Don't be frightened of our bodies. Don't be frightened about talking to friends about it. Go and find somebody to talk to, because generally sometimes your best friends will say, oh, I don't like that. I think you need to go to the doctors. And then that's the push for you. So, I really do hope that both women and men, talk about it. If they're not feeling that they can go to a GP, go and talk to somebody else about it, and you get that little push to go and get it sorted as soon as possible.
And can I just add, sorry, Caroline, can I just add that, most of the time it's not cancer.
Yeah.
And, I think of my brother who became very unwell very quickly, and because the way my mind works, I thought it was cancer. And it turned out he had, irritable bowel, Crohn's disease. So, but it might be nothing. So of those urgent pathway patients, of which there are many that we see, about only 6 to 7% actually have a confirmed cancer. So, patients are very worried about lumps and bumps, as we call them. But, get cancer excluded as well as included, I think is an important message for people.
I think that's really powerful to know that 6 or 7% of any tests that you have, which are, going to pinpoint cancer, will actually be negative. That's incredible.
Well, it'll either say they've got something else, like my brother, or it'll confirm the diagnosis like Moira, or, it may be nothing. It may have been an episode of mumps that caused a swelling in the throat. So that's those patients that are referred on what we would call an urgent pathway. It's about 6 to 7%, and it stayed steady over the years. So it's those patients that the GP is sufficiently worried about that says, I need to know what's going on with this person within those 28 days. So not everyone goes through that route. We pick up cancers through screening, as Charlotte said. That's our preferred way. But the point I'm getting at is there is routes in, and we want patients and the public to take them.
Absolutely. And not to be so frightened of going forward for those tests that you don't go forward at all until the very last minute. That's the point, isn't it? Because it's more treatable. What about going back to preventing cancer, Charlotte, which a lot of your work is about, isn't it? And we talk about risk factors. There are many risk factors. We know that if we all live healthily, we're going to have better chances in life generally. But is there a single biggest risk factor in getting cancer?
Well, there's lots of risk factors. So it's the things I mentioned earlier. I mean, I think that if there was one single thing that I could identify now, it would be of tobacco smoke. And I think that anybody who does smoke, there are services available to help you and support you to give up. And that's the single biggest thing you can do. And it won't just reduce your risks of cancer, it will also reduce your risks of lots of other diseases like cardiovascular disease. So it will reduce your risk of having a stroke or a heart attack as well. So there's lots and lots of benefits to that. As well as that, there's things like obesity, which, can create environments in the body where cancer can grow and develop. So these risk factors, they're very common, and they're things that people can find very challenging. It can be very difficult. It can be very stigmatizing to go and get help about obesity, or if you feel you need to improve your diet and increase your exercise, but there's lots of help available. And I think that's what I'd like to say. That's my key thing to people, is to go and get that help that's available. Well, future episodes of Taking Care of Cancer are going to cover symptoms and diagnostic tests, what it's like having different types of treatment, clinical trials, and some of the pioneering research taking place at Clatterbridge, managing symptoms and the side effects of treatment, and also supporting people through bereavement. And throughout the series, we're going to be hearing from patients like Moira talking about their experiences. Before we finish, do we have one final message from our guest today in this launch episode of Taking Care of Cancer? Moira, do you want to go first?
Oh, thank you. I would definitely say to folk, please don't miss any of your appointments. Go to your appointments, because your appointments are your pathway to getting better. Don't be scared. Don't think, if you're not feeling very well and you think, I'm not going to go today, go. Please go. Because, your clinicians are there with a programme of treatment for you. They'll listen to how you are. They will never, ever pressurise you into taking or doing what you don't want to do. You're, as I said before, part of that team. So please go to your appointments, because that's your pathway for getting better.
You heard it from Moira. And Charlotte?
I think the most important message I'd like to give today is for people to take up, screening appointment offers. So if you get a testing kit for your bowel cancer screening, do the test, send it back, and take up those offers of breast cancer screening and cervical screening when they come through. The other thing to say, I think, about those is you don't need to wait for those screening appointments. So if you've got things in your body that don't feel right, if you've got unexplained bleeding, or you've got weight loss, or you've got any of those other signs and symptoms, lumps or bumps, please just go and get them checked out. And you don't need to wait for a screening appointment. You can just go to your GP and get those things checked out.
Okay, thank you, Charlotte. Liz?
Yeah, I think my final message is one of extreme optimism, because there is so much going on in the field of cancer. And at Clatterbridge, we're now able to offer more precise radiotherapy treatments, and there's more research going on there all the time. More drugs coming online. Every year we have new drugs coming on, and we're now able to do first-in-human studies in our new hospital site. So we weren't able to do that before, and work collaboratively with the system. So one of optimism, hope, and our outcomes are improving all of the time. And, we'll continue to champion all of that great work, and, urge the public to come forward to be tested.
Wonderful, wonderful to end on that note of optimism. Thank you all so much, Liz Bishop, Charlotte Smith and Moira Griffiths-Parr. Just one final message from me, and that is to subscribe to this podcast. You're going to hear lots more from this amazing specialist cancer trust, Clatterbridge Cancer Centre. from patients, from specialists, from scientists. So do subscribe so you don't miss a single episode. And thank you.